Ladies and gentlemen, dear colleagues, good afternoon. I am warmly welcoming all the speakers and participants. My name is Mira Jovanovski-Dašić, and I'm the head of the Southeastern Europe Health Network Secretariat. Today, I will be the moderator of this webinar dedicated to healthcare provision in times of armed conflict. What have we learned from the last European conflict in ex-Yugoslavia? This webinar is a joint event of the European Health Forum Gastein and the Southeastern Europe Health Network. Let me start with a short introduction to the webinar. The war in Ukraine is urging us to reflect on how armed conflict affects the health of all those involved. This webinar will consider the current health-related issues caused by the conflict in Ukraine through the lens of those who have experienced armed conflict in the recent past communities in the Balkans. The goal of this webinar is to understand what the key lessons are from the healthcare related response to the ex-Yugoslavian conflict to better enable us to deal with the current situation in Ukraine and consider priorities for the post-conflict phase. While there are, of course, many differences between the conflict in ex-Yugoslavia and the one ongoing in Ukraine, the webinar is going to focus on the things that are relatable and relevant for both. Where the lessons learned from the past are applicable to the present. Let's see what will come out of this webinar. Now I would like to present our speakers in today's webinar. We have Jarno Habic, who is from WHO Ukraine country office. We have Goran Čerkez from the Federal Ministry of Health from Bosnia and Herzegovina. We have Biljana Lakić, Minister of Health and Civil Affairs, Republic of Srpska, Bosnia and Herzegovina. We have Jaime Calderon from IOM Regional Office for Southeastern Europe, Eastern Europe and Central Asia. And we have Halina Skipalska, Health Rights International from Ukraine. So welcome to all our speakers. And I would like just before going to our first 20-minute session to say a few housekeeping rules. I would like, first of all, to encourage the audience to use the question and answer function, as well as to tweet about the session with the hashtag health care in conflict. So we have come now to our first session, which is dedicated to the conflict in Ukraine and the stories from the front line. Let me ask first our speaker, Halina Skipalska. When we are talking about the delivering of healthcare and the related services in a conflict situation, what are the key issues being experienced on the ground? Halina, the screen is yours.
Thank you, Mira. Dear colleagues and guests, good afternoon. We do not refer to calendar dates in Ukraine anymore because we count the days of the war. And actually today is the 86th day of the Russian war in Ukraine. My name is Halina Skipalska, and here at this panel and meeting I represent Health Rights International and Ukrainian Foundation for Public Health. For more than 20 years, I have been trying to make this world better, to make Ukraine a better country where human rights are meaningful and ensured, where the right to health is transformed into longer and happier lives. All these efforts, as well as work of hundreds of my colleagues from various sectors of public health, civil society organizations, have been wasted and ruined by unjustified war. We face absolutely new realities that are still not well understood and addressed. In this context, any development work in public health is suspended, as all our efforts currently are applied to address the emerging health risks for millions of displaced people and half of the population of Ukraine that has been already directly affected by the war. Health Right International in Ukraine and the Ukrainian Foundation for Public Health continue providing services during the war in such reality. With the support from UNICEF, we coordinate 50 psychosocial support mobile teams in Western and Central Ukraine and 13 GBV specialized psychosocial support mobile teams in Donetsk and Lugansk regions. Every day, these teams provide assistance, counseling, and referral to IDPs and their families and operate in the complexity of emerging risks and threats. Since the Second World War II, the world has not seen such an unprecedented displacement of the people. Ukraine has never seen such dramatic changes in public health priorities, taking place just in 3 months. And there are so many health-related challenges needed to be addressed. I would like to emphasize some of them, like trauma and rehabilitation. Over 640 children and tens of thousands of civilians were wounded by Russian army. Hospitals in some places are overloaded with the patients that are coming every day. Rehabilitation services are hardly available in the current situation. Destroyed hospitals infrastructure that cost disrupted specialized and primary health care to hundreds of thousands. Non-communicable disease. The war has broken, hampered, or disrupted medical supply chains. Thanks only to the support from donors and international organizations like WHO, UNICEF, people with diabetes, those who are on hemodialysis, and certain groups of cancer patients receive life-saving medicines and treatments. Our social workers help to IDPs to find and to access these health services in the places where they moved. Cardiovascular diseases. While donors address immediate needs in medications, patients with cardiovascular diseases like high blood pressure and respiratory disease are at risk, also less visible. And as long as this war continues, as long as we wake up from the air raids, sirens at night, the risk will remain high. Vaccine preventable diseases. Millions of children are at risk of missing their routine vaccination, which will increase vaccine preventable diseases in the future. We encourage and assist families with children to schedule vaccinations for children and receive consultations with general practitioners. Violence and sexual violence. After horrific pictures from Bucha, Irpin, and awful testimonies of rape survivors, the civilized world should consider the creation of new terminology of all these crimes. There are thousands of victims who survived. Today, in our organization, we manage cases of 11 sexual violence survivors, including 14 years pregnant girl. All cases are very difficult, are complicated, and clients require long-term assistance. Some of them need psychiatric care, medical care, HIV testing, STI treatment, and also abortion. At the same time, regular doctors need to understand their role in referring survivors to specialized care and documenting these cases. mental health. Continued stress and PTSD, just some to mention, and the true epidemiology is unknown, as half of the nation has been directly affected by the war in this or that way. Every day, our psychosocial mobile teams identify children with psychological traumas. Quickly about nutrition, we speak about a healthy diet and balanced diet and even malnutrition with some clients. IDPs have already experienced food shortages and mothers experienced problems with getting enough food for their infants. Disrupted education cycle pose significant risk for children of all ages, from social integration and mental health to low motivation and poor educational achievements. In years, it will have a long-standing negative impact on the lives of Ukrainians. And finally, I would like to express my deepest appreciation to all international partners, government of EU countries and beyond, who provide absolutely astonishing support to the Ukrainian people to cope with war and its outcomes. Really, thank you. As a public health organization, we will have to develop and adopt new strategies and practices to help people in need in Ukraine. I don't know what will be tomorrow, but I know we need to act fast and be brave. Thank you very much for your attention.
Thank you very much, Halina, for bringing us close to us the situation on the ground in Ukraine. Now I would like to ask a question. Can health be considered the common ground if this is true in times of peace? Is there anything that can be done to ensure continuity in times of conflict? Of course, this question is for our WHO representative from Ukraine. It's for Jarno Habic. Jarno, the screen is yours.
Thank you, Mira, and thank you also, Halina, for giving the picture of what it is. Let me elaborate a little bit more from the continuity perspective, but also what we are seeing now since 24th of February, and that the war has been escalating. What is very important for continuity is also how actually the current health services are functioning. And there, I would like to compare when we look what is happening in Ukraine and what has happened or is happening across the world. Ukraine's health system has been adapting and providing the services in many of the places. The situation is different across the 25 oblasts, but what is very, very important is that these services have continued and provided by Ukrainian doctors, nurses, and what is important to realize that the humanitarian actors are there to complement and support. And this is very, very important for continuity, also from the person's perspective. What we have seen also since 24th of April, we have seen very agile approach on how services are provided. And while Halina was sharing many of the areas, disease areas, and I might come back to some of them, what we need to look is the granularity of the response, what is very, very needed. I know that my colleague Jaime will talk more about those who have left Ukraine and are outside of Ukraine. And there is very, very important to see how millions who have left, who are in the neighboring countries, and what we see now, many of them returning, how the continuity of care can be provided. And there also WHO has provided guidance, sharing the note also how to finance and provide service packages in the outside of Ukraine. But most important, when I have been discussing with various ministers, is to make materials available in Ukrainian. So the same materials that have been available in Ukraine that are available also on mental health or other areas for those Ukrainians who have decided to be outside of Ukraine now. Now, the second area which is important is where are all those who have moved to the central or the western part of Ukraine. And as we have every third Ukrainian in the movement, Some of them have moved back to Kiev. Some of them are in the move. How to ensure that the services are available for them. And there we see that the way how the National Health Service is contracting the services, or where the doctors are, that the services are trying to adapt where actually people are. And this balance is very important because we need to ensure that the services and the people are matching. And there we can do more, because what we see is the situation is very dynamic, and that is very important that the services are available. Now, when we come to areas like what are liberated now, this is difficult. I have been there in Bucha, in Irpin, looking what has happened with the facilities, and we have so many attacks on health. 2 out of 3 attacks in health in 2022 are happening actually in Ukraine, and WHO has validated more than 200 attacks on health. The government has looking many more. So that is not secure for the healthcare workers or the patients. And there we need to do much how to go back. Many pharmacies are closed. What we saw in the very early days of response was that more than 50% of the pharmacies are closed. But we go to Irpin and Bucha, there we see volunteers, there we see hospitals which are actually distributing the medicines. We see primary care available, but it goes back very slowly. And there we need to look to the basic infrastructure. It's not only having doctors or having the facilities available. We are looking to the clean water. We go back to the basic public health. And that's very important to realize that that is much more complex, and to people to have the services available for continuity of care. Most important are the occupied territories, where important is access, and to ensure that actually medicines are available, delivered by the humanitarian corridors when available. But there we need to really reach to people. And there we know that there are thousands of people who are in need of treatment, who are in care. What my team has been looking is, and being in the field at the time of Mariupol evacuations, people are in dire need for medicines, services. And here, one area, what Halina was highlighting is mental health. We need to do much more in mental health, because services need to be available for many. But also we need to realize that people who have been in shelters for weeks, if not months, how to provide those services, how to reach to them. We have seen the same. We have seen mobile hospitals, which are actually on the underground setting, because that's the only place that people trust to go to have a discussion with a nurse or doctor and to exchange. So that's very, very important, that we need to see this adaptation. But to reach to the occupied territories is important. So what I want to say, that when we look to the continuity of care, and Ukraine is a big country, we need to look those who are outside of Ukraine. We look those colleagues and many of the Ukrainians who are in the move within the country. And there we need to look both the healthcare workers and people who are in the move. We need to look to the liberated areas where situation is very different, and then separately to the occupied territories. And the health service needs are very different there, varying from trauma and working on mass casualty to specific areas, ensuring that the insulin is available for those who have diabetes, hypertensive medicines are available for many, and we need to scale up the vaccination campaign. And this is extremely important in this setting. What is optimistic, why I'm looking also optimistically, is that Ukraine has launched already recovery thinking. Already this week, all the health system colleagues gathered to work on the recovery plan. And as a WHO, we are looking how to connect the previous reform agenda and what Halina was mentioning, that maybe this is in vain, the last 20 years of development and last 5 years of rapid movement on health reforms. But I like to keep the optimistic tone that we need to ensure that the recovery needs to continue the reform path, which was there. And I will say it later as well, but what I really admire of the leaders in Ukraine, they want to see that the recovery is smarter, greener, and more people-centered. And that comes back to the question, Mira, you had about the continuity. The continuity needs to be there on the reforms. The continuity needs to be there for people, but we need to think about that already now when the war goes on and we are soon reaching 90 days. Thank you.
Thank you, Jarno, very much, and thank you to WHO for the support you're giving to Ukraine. Now we will go to Jaime Calderon with a question to understand better what displaced people and third country nationals, what issues are they experiencing in accessing healthcare services, and what solutions are being implemented? I think that a representative from IOM can give us the best answer to these two questions. Jaime, the floor is yours.
Thank you, Mira, and thank you also to Harno and Helena for setting the stage about what's happening in Ukraine. First, I would like to emphasize that we are dealing with a humanitarian situation with a huge elderly population, considering that 20% of the Ukrainians are over 60 years old, and also a challenged health system, especially in the east and the southern part of the country. The context, this context shapes both the health needs and the type of response that we need. On a general note, we see that many non-communicable diseases, and there is also a shortage of certain medicines, like medicines for cancer treatment and for diabetes, not only in Ukraine, but also in Moldova. There are about 8 million internally displaced people in Ukraine, and almost 6 million have fled from the country, plus about 250,000 third country nationals have fled as well to the neighboring countries and other parts of the EU. For the IDPs and the non-displaced population inside Ukraine, access to healthcare is definitely an issue, as already mentioned by Harno. In a recent rapid assessment that was conducted by 5 health cluster partners across the 11 oblasts, more than or almost 0.5% of the household did not know the location of the next primary healthcare facility. 61% reported that they could not access their family doctor, and 43 reported that someone in the household needed health care since the start of the war. And out of those, 45% reported serious problems in accessing care. The main barriers mentioned were security and transport in terms of accessing the health care. As mentioned, there is also a lack of access to medicines, as the stock in the pharmacies is limited due to ruptured supply chain. Obviously, as also mentioned, mental health needs have increased due to the conflict, but also related effects like economic effects and general uncertainty of the future has affected the mental health of people in Ukraine. Mothers and child health, maternal and child health is also an issue, and there is a need for safe delivery, postpartum care. And 10% of the household in the assessment that was conducted by the health cluster partners reported that at least one household member is pregnant. And especially in the East, trauma care for the wounded is also an issue. To address the challenges in Ukraine, already the responses are mobile health clinics are organized and deployed to reach the displaced population. IOM provides psychosocial counseling through a hotline, available also in Ukraine and outside Ukraine, including the neighboring countries. Procurement of medicine is coordinated through the health cluster, which is very impressive, by the way. Medical evacuation has been established and coordinated with the Ministry of Health, WHO in particular, and the EU is working on this. IOM is also leading the working group in the health cluster on health and displacement. For the Ukrainian refugees and the third country nationals who are residing in neighboring countries and the EU, the main issue faced is the continuity of care, as well as what was mentioned by Harno inside Ukraine, both for non-communicable diseases and communicable diseases like TB and HIV. There is low immunization coverage for children, and access to health record is very problematic. In the existing access to services for Ukrainians and the third country nationals abroad, further critical issues are maternal and child health, including access to safe abortion in Poland, and a sound referral mechanism for persons who experience gender-based violence. Further challenges are related to language barriers, lack of adequate interpretation, transposition of the EU Temporary Protection Directive in the national level. In Moldova, for example, where IOM is quite so active, the government of Moldova provides the same services for refugees, including third country nationals. They have access to emergency care across the country. But the government cannot cover costly treatments like cancer treatment and hemodialysis, necessitating the reaching out for support from the international community. Currently, IOM is supporting the procurement and covering costs for exceptional medical expenses of Ukrainian refugees, as well as the third country national. Another support offered is through the EU Solidarity platform, where EU members offer relocation flights to EU countries for the most vulnerable refugees, and this include persons with disabilities and those with medical conditions. For the program, IOM is doing the pre-embarkation medical checks to ensure safe travels, and when needed, beneficiaries are kept in the hospitals for stabilization before departure, and medical escorts are also provided if needed. The government has also started a medical evacuation program together with WHO and the EU. IOM is also setting up the TransMed program, joining forces with ICRC, mainly looking into persons with disabilities. IOM provides mental health and psychosocial support through mobile psychological teams, together with protection teams, as risk of human trafficking are also very high. Last but not the least, also the inclusion of Ukrainian and third country nationals in the health workforce is a way how to ease the burden on the health system and improve access to healthcare for the displaced people. Not only that it augments the health workforce, quality of care is tackled by the absence of any language barrier. Some countries like Poland and Moldova allow Ukrainian medical professionals to work without undergoing the whole accreditation process, as is also recommended for the third country nationals. Thank you.
Thank you very much, Jaime. Unfortunately, we are restricted by time, but of course, we will continue now with some questions that are connected to this session. So, Dorli, the floor is yours.
Thank you very much, Mira, and a warm welcome on behalf of the European Health Forum Gastein to all our panelists and also to the participants of this session. Thanks so much for joining us. We received a number of questions beforehand, and we would like to encourage you to also put some questions into the Q&A chat here during the session, responding to the great input from our speakers, please. A couple of the questions that came in refer to the need to look out for the resilience and the well-being of populations already in advance of conflict, and how can we make sure that that is delivered. Also, there were a couple of questions on HIV care on the one hand, but also how to not lose sight of HIV prevention in times of conflict and war. Another question, and Jaime, you already related to that, is women's health. How do we ensure that especially women, who are the majority of displaced persons at the moment, that their health is taken care of? And then there's a bit of a provocative question, or provocative question there. Should we focus more on universal health coverage? Also, again, more in advance, if we made sure we provided universal health coverage in countries, could we thereby also contribute to avoiding conflict in those regions? Okay, that's it in a nutshell from my side. Thank you.
Thank you, Dorli, very much. Now we shall go to our next session, the session that is dedicated to the conflict in former Yugoslavia and the lessons learned. I will just say that Goran, Biljana, and I are from former Yugoslavia, and we did learn the lessons in the really hard way. So I will have a couple of questions for Goran and Biljana. It will be the same ones. I will ask Goran to answer first. So the question would be, what do you wish you had known during the war that would have helped in the post-conflict phase? And the second question would be, which mistakes should have been avoided? What instead worked well? So Goran, the floor is yours.
Thank you very much, Mira. Thank you to organizer for inviting me, especially to Southeast European Health Network and the Gastein Forum. I would like at the beginning say, and you said already that war in Bosnia and Herzegovina was practically completely different war than war in Ukraine. There are some similarity, but the war in Bosnia and Herzegovina was there were no free territory. The war started on whole territory on Bosnia and Herzegovina, and healthcare had to be organized in condition of limited movement, limited resources, and without clear plan. That's why I think that first lesson what we learned is that it is important as soon as possible to have clear plan of answer. Because also if we see Ukraine or if we see Bosnia and Herzegovina, is not always the same situation in all parts of the country. And you need to have a planning. For the planning, what is the key is have a mapping, different kind of mapping of existing institution, mapping of needs of people, needs of all citizens. Second is that you have human resources, material, equipment, practically to understand what you have and what you need, and what you also to start think what is your intention in the future. Because I have to say that war is also can be opportunity to start some changes. And I talk already with people from Ukraine. I was in one webinar organized by WHO, and my opinion is that example community mental health, and I'm very happy that all participants till to now they mentioned mental health, because I think except wounded people, operations, treatments, orthopedic and reconstructive surgery, the mental health is definitely one of the key. Not just during the conflict, not because of PTSD, because you have to expect in Ukraine what we have is to have much more people with PTSD after the war. After 5-10 years of the war, you will have this. Also the question of migration. You have migrants. Many people, they think that those migrants are safe from the war and they don't have trauma. They have sometimes bigger trauma than people in Ukraine. And also is not similar situation, examples in Kiev now, was not similar situation in Sarajevo and in some other parts of Bosnia and Herzegovina. That's why I think because of this restriction, what I mentioned, restriction of movement, our idea first was to build system that is flexible, mobile, and accessible. And because this limitation practically motivate us to start to build community-based system for mental health, community-based system for other things like physical rehabilitation. And practically we start planning, we start piloting during the war. After that, the war helped us somehow. It's difficult to say this word, but definitely because we have overcapacity in the hospital for mental health. We close big hospitals. We make decision thanks to the war, because many of hospital was destroyed. And we say, okay, not rebuild, let's say start to build community mental health services, more effective, more close to the people, decentralized, with very effective, with high quality. Also, Mira knows because she's from the beginning and I'm from the beginning of Stability Pact, that means of Health Network Engage. And I have to say that we use mental health also as a tool for reconciliation and for cooperation in the region after the conflict. That means I think that health is a key tool for the future reconciliation and for the future trust of confidence and trust between people that was in war. Example, you see Biljana and me during the war, we was on different side. I have to say, we didn't fight with each other, but we was on different side. Now we work together. Last 12 years, we're running reform in mental health in Bosnia and Herzegovina, and we're doing everything together. The war is the past. That's why I think that the health is something what is also important as a not just professional, but sometimes political tool to start to build this communication and rehabilitation practically. And is key planning, and is key that government take all responsibility, leadership, especially Ministry of Health, leadership and coordination with non-governmental organizations, that because they can help. And we work this together with WHO because we recognize that our coordination will be much more easier together with WHO. And we coordinate, practically I coordinate together with WHO. I was on behalf of the ministry. We coordinate all NGOs. We qualified them according their resources, according their capacity, what they can do, and how we manage them practically, what to do, in which area, how to do. That's, I think, is very important, because I know there are many NGOs when war starts, very often in those NGOs, very often, not in all, but you have also people that they see war just on TV, or they read from the books about the war, but they don't have any practical experience. That's why I think that you need to have people with experience. And also I'm very surprised that is not enough use experience from the Balkan to Ukraine, especially in engaging people with practical knowledge that they work all the time in the field. Thank you.
Thank you, Goran, very much for sharing your knowledge and experience, first-hand knowledge and experience from that period. Now I would like to kindly ask Biljana Lakic also to answer to the questions posed that were said before. Biljana, the floor is yours.
Thank you, Mira. Thank you very much for your introduction. I agree with almost all what Goran said. We share, we work together for more than 20 years. I met Goran 2004 in Albania, in Southeast Europe Health Network workshop. So since then we are close cooperate, although as he said, we were on the different side during the wars, unfortunately. So what is good things, what we can share with our colleagues from Ukraine? What can I say? I think good things that we started reform. I will talk more about mental health system because it's my field and I'm the most familiar with it. We started reform immediately after the war, to 1996, and put focus on the care in the community. Also, it was reform of primary health care. We put strong accent in both entities in Bosnia on primary health care level, and we introduced the concept of family medicine team, which was also very important. for our populations. In the beginning, we have some resistance toward family doctors and family medicine team, but later it shows to be very well for the healthcare for the population on primary healthcare. Also, we focus on the transforming mental health system to transform them more to community-based system instead of previous when we more based on hospital mental health system and pathocentric model, which was mostly based on hospital treatment of people with mental disorders and some ambulance or outpatient clinic to follow up. Also, as Goran said, we introduced rehabilitation, community-based rehabilitation, physical rehabilitation services. And immediately after the war, it was very, very, very important for our population. So that Ukraine also can use, I think they need to transform their mental health system, even if it didn't happen the war. So, and I think they started a lot of doing toward community in the war. As I heard, they have mobile psychological teams. It's very important. I think Ukraine is very huge country, very big country with different areas and different settings. So especially mobile teams are important in times of war, but also when war stops, that mobile psychological teams can be used for to provide healthcare to rural area, which is also very present, I think, in Ukraine. Also, they will need the reconstruction, adaptation, etc. Political will is very important to start with reform, I think. So, probably because of so many millions of internally displaced persons, so many millions of the refugees, I think context in Ukraine is significantly changed. And after the war, probably many mental health problems will arise. Now we can probably see many acute trauma reaction. That's why I think it's very important to training professionals to recognize about traumatic stress and post-traumatic stress disorder, but also after the war, we had experience in Bosnia, and that was that was your second question, Mira. What we could do perhaps better, but I can say mental health doesn't depend just of the health system. It depends of many other systems. So we probably they can be a huge risk of chronification of post-traumatic stress symptom after the war, when people will face with unemployment, with the wasted communities, poverty, many losses, many refugees, many internally displaced persons. Some research we did after the war shows that, for instance, the best predictor of chronification of PTSD is exile or refugee status, and also material insecurity, then wounding and serious illness. There will be a lot of wounded people, impairment of the senses, conflict situation within the family, and exposure to violence, witness to death or violence, and also sex. It seems somebody asked for women health in general, but women are can be expected to be more vulnerable to stressful events and depressive reactions. And also what we noticed after the war, that many people, many refugees, internally disabled, internally displaced people, and use avoidance and not talk about their experience, which also put them in risk for chronification. So, as Goran said, I agree. If we can, I don't see nothing good in the conflict, but it can move. It can move or force the system to build or rebuild the better mental health system according to huge needs of population they will face after the war, and they will face it, of course, now. So that's about it. I don't know, perhaps but I wanted to share with you.
Thank you, Biljana, very much for letting us know your suggestions and proposals that are based on the lessons learned from former Yugoslavia. It is very important to hear this experience as well. Now, I would like also to go again to Jaime Calderon and to reflect a little bit which were the solutions implemented to ensure continuity of care for displaced populations that worked the best, and shortly, which were the major hurdles and what more could have been done. So the floor is yours, Jaime.
Thank you, Mira. One solution to ensure continuity of care that I am well aware of is the IOM Special Medical Evacuation Program. This program evacuated more than 1,500 war victims suffering from serious medical conditions with favorable prognosis that cannot be treated locally and is stable enough to survive air travel and withstand delay until the actual travel. Documented data shows that by August 1994, patients were evacuated to hospitals in 31 countries. As the war continued, the program scaled down due to the lack of financial support, but the number of vulnerable people assisted by IOM continued to increase through other programs. For example, in 1999, as the Kosovo refugee crisis was unfolding, the IOM UNHCR humanitarian evacuation program airlifted over 60,000 refugees to host countries in Europe and overseas, or about 20 countries. A significant part of IOM's work in this process included pre-departure health screening, ensuring fitness to travel, and where needed, medical support before and during travel. The major challenges faced during the war are the bureaucratic obstacle and the ongoing aggression delaying the evacuation process. In the early part of the program, patients had to wait for several weeks or months to get placements in hospitals abroad. But as the visibility of the program increased, the time between documentation and hospital acceptance diminished. As for the interval between acceptance and evacuation, there was largely dependent on the entry and residence formalities of the host country. There were bureaucratic obstacles in receiving countries as well, and as well as the former Yugoslavia delayed the process. For example, in Bosnia, initially 29 signatures per patient from various ministries and local authorities were required to approve the departure of its citizen. Gradually, this procedure was eased by the Bosnian authorities. Another challenge faced was the impact of mass media on the program. At the early stage of the program, media attention was provoked by the case of a Bosnian wounded girl named Irma, triggering international awareness of the plight of the many severely wounded patients. While this attention increased the financial contribution and hospital placements for the war-wounded patients, the media frenzy also complicated the timely placement of adult males and majority of the caseloads from other regions of the former Yugoslavia. Substantial time and resources have to be devoted to explaining to hospital and government authorities that the application of criteria other than the medical ones would weaken the ability of the program to bring relief to all persons in need. So that's from my experience when we were working on this special medical program. Thank you.
Thank you, Jaime, very much. Now, because we are again restricted with time, I would like to give the floor to Dorli for the questions and answers. Dorli, the floor is yours.
Thank you, Mira. There were a couple of questions coming from the audience, mostly related to how, and Goran, you mentioned, that of course, there's no comparison between the two wars, but how we could use that experience. And for example, one specific example was what you mentioned, Biljana, the post-traumatic stress disorder rehabilitation, what experiences could be used for the Ukrainian colleagues now. And just generally a question to the Bosnian colleagues and to both Goran and Biljana. How would you have reacted 30 years ago if you had today's knowledge? Would it have been different? Would your response have been different? And maybe the colleagues could answer quickly now. And I would afterwards like to go back to our colleagues from the Ukrainian panel, whether you have any answers to the questions from the audience from before. Thank you.
I will try to say one short answer. First of all, we need to start prevention on mental health now. That means immediately. This doesn't depend, as we said, from health. This depends also from other. The key question what Ukraine and what we have to answer is always how to provide well-being, because well-being is a key. Well-being cannot provide health system. Well-being can be provided by schools, by culture, by other sectors. That means participation of all other sectors. To don't stop with the culture. Don't stop adapt children gardens, even if they are in the underground. You need to adapt to the children's needs. That means we can do a lot of things now. We don't need to expect the end of the war to treat just PTSD. There are a lot of prevention. Just one short reaction. We have many programs. I think that is important also about when we are talking about refugee wounded people, we sending also in abroad. But I think that is much better start to build immediately where is possible capacity in the country, with coming with experience surgery people in the country, taking them to the country because they can do much more instead to send in abroad. Of course, you cannot do for everybody, but for absolutely, we have excellent experience with Medical Sans Frontier, that they operate, that they treating patients in different area with excellent surgical staff from UK, from France, from different countries that they coming. We didn't import. That's a short. And leadership, as I said, leadership, I would like to repeat 1,000 times. Leadership of the Ministry of Health on Ukraine is a key. Take responsibility, coordinate all activity, use UN agency together to strengthen your capacity and do that.
Thanks very much. Mira, if you don't mind, could we ask the Ukrainian colleagues if they'd like to respond to what Goran just
No, go ahead. I think it is important that we continue the answering of the questions. Please,
okay, thanks very much. Jarno or Halina, do you have any response to what Goran was just saying or to the questions that were posed before? Thank you.
I suggest Halina will start, and as we did before, and I will add if there is anything.
Yes, but questions were so good, important, and Goran provided really good comments. So I just want to emphasize some things where I have expertise. I really like this message, which already shared by Jarno, that let's use this this wartime and to continue reform of health system in Ukraine. I also would like to emphasize the importance of start of reform in social sphere, which should be complementary to health reform. So in this case, we will have at the end as an outcome some well-being improvement in Ukraine. And I can move to the question related to HIV, STI prevention, prevention work, because there was such question indicated. So there can be like two strategies. One, to continue this reform which started of health system in Ukraine. So one strategy can be to strengthen primary healthcare system, and our general practitioners, in fact, they can do HIV testing, STI testing, referrals, screening for mental health using MHGAP, GBV, screening on GBV case, and again, appropriate referral. So one strategy can be strengthening primary health care, because so we didn't pay attention to this during last 2 years, because our general practitioners were also overwhelmed by COVID-19 issues. So they also thought about treatment of these patients and vaccination and other things, and didn't pay enough attention to issues like HIV, STI, and other disease. And another strategy can be to give actually flow to the and identify roles for civil society organizations. They really can do this, even specialists of state social system. They can do HIV testing, referral, case management for these clients, and ensure that these clients receive health services. Actually, speaking about Ukraine, we have enough strong civil society organizations which did a lot of work in past and also are ready to do and help health system to be stronger. Thank you.
Thank you very much, Halina. Jarno, please.
Thank you. And maybe to add three things from my side. One question was about the preparedness and being ready. And when I look from WHO's, we started to prepare since last autumn, and looking to the guidelines which are available from WHO, how to be ready for the armed conflicts, what we call Red Book, making it available in Ukrainian, pre-positioning all the medical supplies, ensuring the supply lines to be in place. But none of us was ready for this type of escalation. So then I think what we have learned, at least from WHO side, you need to prepare, but you need to be very agile also in response. And what we have seen is in our logistic lines, in many of the other areas, we have used approaches which have been never used anywhere else in the world to support Ukrainian civilians, healthcare workers, and others, not to go to the details now. But we have a lot of also to learn. So it's both preparedness and then to be very focused on the response in the agile way from the first day. And there, the second is to learn what Ukraine has been learning as well. So we are discussing here experience from the past, but then also we need to realize that Ukraine is in the war since 2014. And a lot of the good practices and what Halina was mentioning, the work around MHCAP, where we, before war, had more than 50 partners working on mental health and MHCAP, but they were focusing mostly to the Donbas, where we had needs were around 3 to 4 million people to support. Now that scale of response to the mental health is 10 times higher. So we need to learn also what has worked in Ukraine, but then also go to the scale. And this particularly is around the MHCAP, around the mental health tools, community mental health. But what was mentioned also very important, I think both for Halina and then colleagues also, that it is beyond health sector. It needs to cover all the sectors. It is about health, education, and we need to ensure when we look to them people and their stress levels that it is all. We can do certain things, but also health sector cannot do it all. And on the stress management, what is important, and our experience with COVID in Ukraine was that we started, of course, there are many tools on stress management, and what we have been using also in Ukraine for people we learned how important it is actually to invest to the resilience of the healthcare workers, because they have been in the front line for the last 2 years. And now with this war, mass casualties, people in the move, this support for the healthcare workers is also very, very important. So when we talk about the population, let's not forget those who need to be in the system to support. And there, of course, what Goran was mentioning, there are others who can come and help. A number of the EMTs, the system that WHO has been developing in the last 10 years. And we have UK Med, who is in the front line working. We have, of course, MSF and the Red Cross. But when we go to the EMTs, we have also others like Kadus, who is managing all the patient movement together with colleagues from IOM and others. So we need to look how they fit into this picture, because we want what Ukraine was developing was the e-health system, other systems. We need to ensure that humanitarian response is well embedded to the national system. And finally, there was, Dorley, I think, one question about universal health coverage. We shouldn't forget universal health coverage, but what I really have learned, and many countries have actually, and we talk too little about, is about health and security. And I think we need to talk about health and the security together from various angles. But when I was in Pucha and we discussed with the primary healthcare workers and the people who are returning quietly, are you feel secure to go there? Are you secure to go back to your home? We saw huge resilience. I saw so many gardens which have now flowers, houses which are painted again, but too many houses don't have anymore the roof. But how you go back, and we need to look at the security from various different angles, but the health infrastructure is part of the security. And I think we need to think much more practically about UHC. I think if we want to achieve it, we need to do much more practical things on the ground. And this is, I like Ukrainians, because in Ukraine, you need to do practical things. We don't talk too much, actually.
Thank you so much. I will hand over to you directly, Mira, for the final panel. Very, very interesting to hear from all of you colleagues who have actually been involved directly in the response. Thank you so much. Over to you, Mira. Thank you.
Thank you, Dorley. Actually, our last panel is an open panel discussion. Our speakers have tackled many points of the open panel discussion, and I believe that we'll keep our time, and then we will be able to tackle some topics that are also very important in the next 15-20 minutes. So in the open panel discussion, what we would like to tackle, well, to understand a little bit more on the healthcare system's resilience, then to maybe say a few words on the role of the civil society. Again, we want to come back to mental health. I really value what Goran and Biljana have shared with us. So a little bit about mental health. Then, of course, about displaced people and third country nationals. And of course, financing and the response of the financing. So I would kindly ask you when I will tell you which questions we would like to pose connected to these topics. And if you could just raise your hand and shortly maybe answer to the questions. So let's start with healthcare systems resilience. So very shortly, what makes health systems more resilient to shocks such as war? I see Goran. Goran, please, can you?
I try really to be short and in somehow summarize what already was said. What health system make more resilient is to having preparedness and response plan, trained staff, system flexibility, good and mobility, good communication and coordination. If you have all of that, you are more definitely resilient. And one comment, Jarno explained situation. I have to say that I work in Sarajevo in surgery during the war. 4 years Sarajevo was under the siege, 4 years, almost 3 years without electricity and water that was practically delivered. And this flexibility, mobility, and invention of people help us to survive, I have to say.
Okay, thank you, Goran, very much. You already tackled the importance of starting early with the reforms. So I think we can complete in the open panel when we are talking about healthcare systems resilience. Now, I would like to ask the speakers to say a few words on the role of civil society. And especially on the coordination of the civil society organizations, who and how, the importance of the civil societies in ensuring communities' access to healthcare related services during the emergency. And of course, I would like also to understand a little bit on the contribution of these civil society organizations in the Balkans, in the part of coming to the peace. So do we have some of the speakers? Yes, Jarno, I see your hand, please go ahead.
Thank you. And I will start, and maybe Halina can also extend, because what we see from WHO and what we have seen in 2014, what we have seen when COVID started in 2020, and what we again witness in 2022 is extreme agility of the civil society in Ukraine, and that they are also volunteers, but they are really reaching out to hard to reach places. They are really trying to cover the gaps where there are problems in the distribution lines. And so civil society plays in Ukraine very important role, complementing the health system which is in place, supporting also reaching out to many of the vulnerable. So I think that's what I want to say, is that they play very, very important role. And they are also the drivers of the health reform since 2014. So they have the role of keeping the government accountable, but they have also a role in the service delivery. And what is important is that it gets well coordinated with all the humanitarian activities which are coming from outside, because they all need to go in the same direction. Many have mentioned the health cluster, and as a WHO, as a cluster lead agency, it is wonderful to hear. But what is important is really that the people coordinate at the local level as well, because I think that's even what is happening in every village, every town, in every Hromada is something that we need to see, especially when building back. But Halina is working in many of the NGOs, and there's a wide group of across the country she can extend.
Thank you, Jarno. Just briefly to add that we observe that there is time to do this coordination from the state side on national level, and also, as Jarno mentioned, on local levels. I'm not sure if Hromada cities now have resources to do really coordination, but at least it should be at regional levels. We have 24 regions of Ukraine, so national and regional level. Sometimes I would say that, yes, different clusters run by different UN agencies are very important in terms of coordination of humanitarian support, but at the same time, now it's time to complement these activities, sometimes very innovative models to what can be sustainable in the future. So this is why I'm saying that yes, coordination is needed, and usually it was some witness side in Ukraine coordination, but national level and local level, national, I mean, with the Ministry of Health, Ministry of Social Policy, Ministry of Education and Science. There are some topics which should be coordinated through few ministries, like, for example, adolescent health or the same gender-based violence, sexual violence, including HIV and others, so and displacement. And national and local levels. So, and we observe that many UN organizations start to lead conducting of meetings of the subclusters on regional levels. So it's a good approach.
Thank you, Jarno. Thank you, Halina. At this stage, I would like just to say a couple of words on the Southeastern Europe and the contribution to the peace in the Balkans. And I hope that Goran will contribute a little bit additional to that. This network was actually established in 2001 to promote progress and encourage reconciliation and economic development and stabilization in the region. The immediate focus was on stimulating cooperation on reconstruction processes beyond the borders and individual self-interest of Balkan states. In other words, to serve as a vehicle for peace and health development. So Goran, just if you could add a little bit on the network. So I have to say, today still we are again a vehicle for peace and health. So it's not changed very much from the period in 2001, but I think you recall even better. So Goran, please, if you would like to say a few words.
I already said, and I think that you complete what we said. The practically the health was a tool for restoring trust and reconciliation in the Balkan through the Stability Pact process, was cooperation between health professionals through the implementation of various programs. Now this tool is for the development of region, development of public health, and that show definitely how health can help in this process. And what is important through this cooperation, we all know each other from the ministry, not just that we communicate with the papers, but we know each other, and in every moment we can call, we can contact. We start to be, after 20 years of collaboration, good friends, I have to say. And is important also for the professional level or capacity of the country to work in a really nice atmosphere what we have.
Thank you very much. Now
also we have good support of WHO all the time. Practically, it's important to mention the partners because we forget. Calderon is also, my friend, is always present in the meeting, and Gastein Forum is also our partner, and I think that is very important to mention because I'm very pleased to be a part of Gastein Forum, because really they support our region in different activity regarding knowledge exchanging of experience. And really thank you also to all people from Gastein Forum.
Okay, thank you, Goran. Again, we come to a topic that is we tackled, and I think it is important to speak again about that. Mental health. So cross-sectoral collaboration, who is it important to involve and why? So is there someone who would like to say a few words? Biljana, please.
Yes, thank you, Mira. I think many speakers and colleagues today mentioned that importance of cross-sectoral or intersectoral collaboration in provided mental health services. And I think it's one of the main characteristics of community-based mental health system. Multidisciplinary teamwork and intra and intersectoral collaboration. It's very important, as Halima and also colleague from WHO mentioned, and many other speakers today, to cooperate closely with educational sector. We have good experience in employing psychologists and psychologists in primary schools, so they can help the children in the school setting, assess the children in needs, or refer to another services if it is needed. So it's very important. Also, educational work or labor sector, social sector is very, very important also, and we have to work very closely with social sector, then police and legal sector, and almost many other sectors are involved. Also, it doesn't have much with cross sector, but it has stigma attached to mental health problem. Also, I think it is big issue, and I don't know situation in Ukraine, but we had a problem with widespread stigma attached to mental health illness and conditions. So I think it's also important to take in notice and to do mental health literacy of people, like promotion of mental health and prevention activity. So I wanted to say so many things, but jump from the one to other. Okay.
Mira, if I can say just that what is important to mobilize everybody who can provide this small of well-being practically to the people, definitely, who can restore our well-being or who can maintain our well-being. This is a key for mental health. And about refugee, I was also in Istanbul together with Calderon. We have extremely good discussion on mental health and health of refugee. One important topic is, when we are talking about mental health of refugee, don't forget also that mental health of people where refugees coming very often is affected, because this is a lot of change of culture, a lot of change. That means we have to work also with population where we have this migration, not just with refugees. Don't forget them.
Okay, thank you, Goran. Now I see that Jaime has raised his hand, and after that we have Helena.
Yes, I would just like to include, of course, that for instance, in Moldova, provision of training for psychological first aid for all kinds of first-line responders, including the border staff and those who are in touch with refugees and the third country national, is very important. Hence, it is really we really have to think about expanding just beyond the target group, but also considering the health professionals, beyond the health professionals as well as the other sectors that are working in this situation. Also, close coordination with authorities engaged in countering trafficking, for instance, is important in mental health response. So, as you know, mental health needs of individuals who experience trafficking are extremely high, and as well as also protection teams have access to these communities. Thank you.
Thank you, Jaime. Now we have Helena. Helena, please.
Yes, I would like to add quickly about importance of focusing on mental health of hosting communities, as Goran mentioned. Even now inside of Ukraine, we observe that in some places, hosting communities, we are mainly considered by us as transit zones. I'm speaking about some transit regions, for example. For IDPs, they also face a lot of problems. So hosting communities and their mental health, and also mental health of health providers and other specialists who work with IDPs, traumas. All these people also need support, and we know about needed support for mental health providers due to COVID-19 pandemic. So now we have additionally to COVID-19 war, or still have COVID-19 and also war-related issues, and people who are overloaded and work under unbelievable conditions. So their mental health can be also in our focus.
Thank you very much to all of you, and we are coming slowly to the end of this session. But before that, I would like to ask Jaime shortly to say a few words on how to ensure all receive equal access to healthcare when we are talking about displaced people and third country nationals. So Jaime, the floor is yours.
Yes, I think it is important that the neighboring states need to ensure that all those fleeing Ukraine are granted unhindered access to territory regardless of the status and in accordance with the international humanitarian law. IOM strongly advocates for that protection and immediate assistance, including access to health care, are provided in a non-discriminatory and culturally appropriate manner to all the conflict-affected people throughout their journey to safety. IOM welcomes also the European Commission decision to activate the Temporary Protection Directive to assist people fleeing Ukraine and to introduce third country nationals in such a protection measure. However, as far as the TCNs are concerned, or the third country nationals are concerned, some of the member states are still not very agile in the implementation of this directive. For example, in Poland and Hungary, third country nationals could only stay for 2 weeks. So we strongly advocate for countries to support this directive. Also, safe relocation of third country national. IOM is collaborating with states, embassies, border authorities, and government partners to ensure that third country nationals are able to return home from surrounding countries. As an example, IOM has been assisting hundreds of Azerbaijani who fled from Ukraine to Moldova to safely return to their country of origin.
Thank you, Jaime. Unfortunately, we have to close this session. Of course, we could speak for hours, but as I have mentioned, we are restricted with time. Before finalizing the webinar today, I would like to kindly ask you to each speaker to mention their takeaway point, a short one, so that we could have your final short reflections and take home thoughts. So please, who is going to be the first one to say their thoughts? Okay, Jarno, please go ahead.
Thank you, and thank you for all the colleagues. That's first of all. It's always opportunity to learn and share. I would take away 3 words, and these are response, recovery, and resilience. And why I mention those is what we have seen in Ukraine is that the response is agile. Can more be done? Of course, but as days go by, we need to see how to move on with the response. The second, on the recovery, what was said before, it's important that the government takes a lead, which has taken place already. And we see that the recovery wants to be more smarter, more greener, more people-centered, and that to use now the coming months and years to recover to better Ukraine. And the third is the resilience. What I have seen is really the resilience of the healthcare workers. What has been said also, they work under unimaginable situations, and trying to find the ways how to actually treat civilians and other groups. So I think these are the 3 really words to take what I have seen in the past weeks and months, but also from this discussion. Thank you.
Thank you, Jarno. Halina, please, can you give us your last?
Yes, I would like to emphasize one time more importance of continuation of reform of health system in Ukraine, role of civil society organizations, as we are already doing a lot of things and help to strengthen health system, social system, and coordination. Yes, it's also important issue, and we will work on this in the future. Thank you.
Thank you, Halina. Biljana, can you give us your thoughts, your last thought?
My last thoughts is no health without good mental health. So mental health is really highly on health agenda, and I invite all policymakers and government not to show just to show also budget sensitivity for mental health and to invest more in mental health.
Okay, thank you, Biljana. Now we have Jaime. Jaime, please, can you share your last thought?
Yes, looking towards the future, IOM strongly advocates that the right to health and access to health services must be respected and safeguarded for all displaced and war-affected people in Ukraine and the neighboring countries. Health workers and health facilities and supplies must never be targeted, and any attacks on the healthcare violate international humanitarian law. And we are very thankful, and also for the guidance of WHO and the way they work, particularly since it was mentioned about this recovery. This is something that IOM has been thinking for a while regarding the recovery phase and the rehabilitation process. Over.
Thank you, Jaime. And now the last but not least, Goran, please, can you give us your last thought?
Start to work on well-being now, together with all sector, trying to protect mental health, but also start preparation for the future reforms in Ukraine.
Thank you very much. I think that we have come to the end of our webinar. I would like to thank the speakers, the participants, European Health Forum Gastein, and everyone who contributed to this webinar to take place. I would like just to give also 1 minute to Dorley to also address the audience. So from my side, thank you for your time and for sharing your knowledge and experience. I wish you a good day.
Thank you very much, Mira, and a big thank you to you for taking us through this session with such important and such heart-touching topics that we addressed today. And at least from my side, I can say I'm definitely taking a lot home after this session today. Big thanks to all the colleagues for joining us, especially the colleagues from the Ukraine, and wishing you all the very best. And big thanks to the Southeast Europe, Eastern Europe Health Network, our partners, for co-hosting, and to you, Mira, for guiding us through. And we have a forum coming up in the fall, so hopefully in September we can meet in person again, and we would very much like to see you all there. Thank you very much. Goodbye.
Bye, thank you.